Senator Barrasso.
Well, thanks, Mr. Chairman. I appreciate your efforts here because, as you and I know, and many know, that since 2009, 15 years ago, I've been warning that Obamacare would increase premiums in spite of what President Obama may have promised the American people, which I think was called the lie of the year. Now families in Wyoming are being hit with premium increases of up to $2,000 a month. I got a text today from a rancher who finds himself in that situation. Like, I've never supported Obamacare or any effort to expand this broken system, including the creation or the extension of the Biden COVID bonus payments that the Democrats put in place, and they chose the end of this year as the deadline date for that because they were supposed to be temporary due to COVID. What we're seeing now are the results that they speak for themselves. And Democrats would like families to believe that these skyrocketing premiums are the fault of Republicans. That couldn't be further from the truth. These spikes were predictable, they were warned about, and they're the direct consequence of the law that Democrats wrote and passed 15 years ago that not a single Republican voted for. And of course, that was a law that promised affordability and failed completely. So Brian, let me ask you, if these temporary subsidies were a solution, why have premiums continued to skyrocket even after Democrats poured billions into these COVID bonuses? What exactly did that money fix?
Yeah, Senator, thank you for that. I agree with you. The ACA has deep underlying structural problems, and the subsidies just exacerbate it. They just put more taxpayer fuel on a regulatory and subsidy structure that is raising premiums and raising prices and just creating a much more inefficient healthcare sector. And some of the inefficiencies of the ACA even bleed over into the employer market, and some of the rising premiums in the employer market are from problems with Obamacare.
So for Brian, and then I'm going to go to Doug after the same question. So 15 years now, I've been warning that Obamacare would devastate access to care in rural America. Wyoming, rural state, frontier medicine. Many of our rural and frontier counties, there's only one insurer left, so hospitals are closing. So Brian, how can a family exercise choice when there's only one insurer, no insurance insurer on the exchange at all?
Yeah, they can't exercise choice if they don't have a choice of any insurers. What they need is additional options. States can put in place Farm Bureau plans, and we've seen about 15 states now allow Farm Bureaus to sell coverage that can benefit rural residents. Short-term limited duration insurance offers particular value in rural areas. They have much broader networks of doctors and hospitals that take that coverage than accept ACA coverage.
Yeah. Doug, do you want to add anything else in terms of what we can do competition-wise in rural America?
You have to find pooling mechanisms, and Brian's outlined several. There are probably others if we put our heads together.
So are there reforms that we could actually put into law that would actually bring competition back into rural America?
Yeah, well, I think first, the One Big Beautiful Bill, by addressing some major structural problems within the healthcare sector and the government healthcare programs, put in place the Rural Hospital Transformation Fund, and that is $10 billion a year that is going to rural areas within states so that they can improve access to care for rural providers. So I think that is a real benefit of the reconciliation bill. And then just work on expanding as many options as there are and empowering patients with more control over the financing.
Good. Doug, for years, you and I've talked and I've been warning about Obamacare handing control of our health care system to insurers instead of the patients and providers. Has this consolidation under the ACA increased costs or just for patients and for taxpayers under Obamacare?
In general, consolidation increases the potential for market power and abuse of that market power. It's something that we need to watch in all sectors of the economy, includes the ACA. And generally, you find more consolidation where there's an excessive regulatory structure that the larger firms can manage and take advantage of, and makes a barrier for entry to new competitors.
So, Brian, in Wyoming, I've looked deeply into the numbers. What I see is, the high subsidies. We're one of the highest subsidized states. You have the Biden bonuses on top of that. We have about a third of the people that are on Obamacare who pay zero. They're zero premium. Can you talk a little bit about these zero premiums, some of the schemes that have been devised under this Biden? COVID bonus?
Yeah, thank you, Senator. The availability of fully subsidized plans have created a recipe for massive improper enrollment schemes throughout the country. Just yesterday, DOJ convicted 2 individuals who are running one of those schemes. It's a $233 million scheme. We estimate there's more than 6 million improper enrollees, and one of the best pieces of evidence that we have of the massive increase in improper enrollment is that 40% of fully subsidized enrollees in 2024 didn't use their health plan a single time. No doctor visit, no prescription, no lab test, and that's very unusual with people with health insurance. Most people with health insurance use their plan every year because so much goes through health insurance.
Thank you, Mr. Chairman.
Thank you.